What are the side effects? People tell me about dry eyes and more complex things like suicides in America.
Wow, we've just jumped right into it. So, LASIK, when done on a correct candidate, is a great surgery. Let me define what a correct candidate is for you. One is the patient should be highly motivated. Let me tell you this incidents where, when it's marriage season, you'll always get these parents. I had a set of parents who came to me highly motivated for LASIK for their daughter who was going to get married, hopefully in a year. And I was
Fingers
like,
crossed.
yeah. And I was like, sure, like the arranged marriage scenarios in India. So I was like, sure. And she had a great number. She was a candidate. Her corneas were beautiful. Everything was set. And the girl who was all of 20 is like, you know what? I'm happy in my glasses. I don't want to do LASIK. So those are not right candidates for me. I think the patient should be the motivating factor behind doing a surgery. So if your parents are pushing you, is not right for you. So first and foremost, you should be a motivated patient. Secondly, once you do all the tests, if you have enough thickness in your cornea, if you don't suffer from dry eyes, if your number is stable, you're above 18, and you check all these boxes where you're safely undergoing refractive surgery, then you should undergo refractive surgery. Then comes post-op complications, right? So you have to have a long chat with your doctor on what to expect when you're undergoing a LASIK surgery. If you understand what that is, you're not going to be shocked with the post-op. You cannot touch and rub your eye immediately after surgery. There is a number of period of time that you're going to have to use your eye drops. So if you use them correctly, come for your follow-up, by and large, nothing happens. However, if you've already been suffering from dry eye, LASIK and other refractive surgeries are known to worsen that. So you're going to be miserable with this.
Can I get LASIK done twice in my life? If, like you said, I do it once and then I get a power later.
Yeah, so if you have enough cornea, if your thickness is okay and the stability of your eye is okay, you can get a touch-up LASIK, as we call, where it's a re-LASIK. Whether you're doing it, again, lifting the same flap on the surface will be decided by the doctor. So there are patients who have gotten LASIK done twice or a touch-up LASIK, but that's only if it's completely safe for your eyes. Because we don't want to give you so much laser where, we're risking any other problems, especially like ectasia, where your cornea becomes loose.
Got it. What do you think are the biggest myths regarding LASIK that just refuse to die?
Like I said, the biggest myth is I've gotten rid of my glasses with LASIK and now I'm never going to get glasses. As I explained to you, yes, you are. Everyone will get reading glasses. 2, LASIK is for everyone if they have glasses. No, it's not for everyone. First and foremost, you have to have a stable number. So a number which is constantly changing is not a right person to get LASIK done. Third, LASIK is such a easy procedure. I don't really have to worry about anything before. Yes, it's easy, but it's easy for the doctor. It's important that you follow what you're supposed to before and after. So, you do that correctly. Fourth is, my friend had no issues, so I'm going to have no issues. That's a big one. Your LASIK story is your LASIK story. Okay, it's never going to be the same as your friends because every eye is different. So even the difference may be between your 2 eyes. So don't keep comparing. These are like the biggest myths.
What are the biggest mistakes people make after LASIK surgery that can ruin their eyes?
So the biggest mistakes people make is 1, they don't put their drops on schedule like they should. 2 is they don't take the no touching the eye seriously. So we've had patients who've actually rubbed their eyes, because they put a drop and it started burning. So I had a patient who actually vigorously rubbed their eye on the second day after doing LASIK surgery, and there was a complete, what we call, dislocation of the flap and wrinkling. So we actually had to take the patient back in, what we call iron it out, and send them back out. So that's like a big reminder. That patient never touched his eyes. I think he still probably won't be touching his eyes.
But did he have permanent damage or what?
No, so touch wood. We caught it fast and we done it.
When you say ironing it out, I think of a istri on my face.
It's pretty much like that. So
Jesus Christ.
So the mistakes patients make is touching and rubbing your eyes, not putting your drops, not coming for the regular follow-up, because once a week is over and you're completely comfortable, patients tend to forget your 1 month follow-up, 3 months, because I'm okay, I don't need to get checked. So that's
such a quick procedure.
So that is the biggest mistake. And of course, not doing your homework. You should be going to a person who is trained in refractive surgery because people think it's such an easy, 5-minute procedure. Any doctor can do it. It's not true. We undergo a lot of training, a lot of cases before we actually operate on your eyes. So it's smart that you do your homework and go to someone who's trained in it.
And the scary question that a lot of people think about, especially me, can LASIK cause vision loss?
So yes, LASIK can cause vision loss, but it is a really, really, really small number. It can cause vision loss in the sense that if something goes wrong and you get a severe infection or something like that, then it hampers your vision. I wouldn't say vision loss, like a scary thing, but blurry vision. Or if you get a complication, like a wrinkled flap, like I mentioned, it can cause blurry vision, any inflammation or infection. But you know what? See, whenever we are undergoing any surgery, there are always chances of complications. The way I counsel my patient is if there's a complication, I tell them this is the complication and this is the solution. So if I say your flap may wrinkle, but we can iron it. You may get infection, but then you have to use more drops. You may get high pressure, but you have to use certain drops. So if you're going to see a problem and you give them a solution, most patients by and large do well. It is when you have complications in which you don't have a solution, which causes the issues. So can it cause vision loss? Yes. Does it cause vision loss? No.
For most people, when they're looking at doing LASIK, they Google it and whatever comes up first, they go there. What should someone ask the doctor to know that this is the right person and is advising the right surgery?
So the 3 things I would ask my doctor if I was a patient is first, which surgery are they actually going to do for me? Because as I mentioned, refractive surgery has a lot under it. So which of the surgeries is going to be right for me? Second is what to expect in the pre-op and the post-op, which means what precautions should I do before coming for the surgery? And post-op, what is my expectations regarding my drops, when my vision is going to be clear, when can I start work? And the third thing that I would ask my doctor is what to expect during the surgery. So I'm not startled or shocked what's happening. I would like to be run through the process of what's going to happen, how long it's going to take, and how I'm going to feel. So those are the 3 top questions that I would ask my surgeon.